Hello and welcome to the Gonzales Mitchell Show. I'm Clay Mitchell.
And I'm Patrick Gonzales.
And today, our special guest on the show is Mike Murphy. Mike is the Senior Vice President and Chief of Staff for the Committee for Responsible Federal Budget, where he manages policy research and analysis on a variety of topics related to fiscal policy and the federal budget. He's also the Director of FixUS, a special initiative by the committee uh, that through a number of efforts and partnerships seeks to better understand the root causes of our nation's growing divisions and deteriorating political system. And he works with others to bring attention to these issues and the need to fix them and tries to build support, all the support necessary to effectuate those changes. Mike, welcome to the Gonzales Mitchell Show.
Thank you, Clay and Patrick. Great to be with you.
Good
First
to have
question
you.
is, Mike, the Committee for Responsible Federal Budget, what is, I guess, your mission? What's your purpose?
So the Committee for Responsible Federal Budget is a nonpartisan, nonprofit organization. We're based in Washington, D.C., and our mission is that we're committed to educating the public, engaging policymakers on the need for fiscal responsibility, right? And primarily about the need to raise awareness about the need to put our country on a more sustainable fiscal track. Our leadership is made up of a board of directors that is bipartisan. Our co-chairs are Leon Panetta from California and kind of former head of everything, right? CIA, Defense Secretary, White House
Right.
Chief Budget Director, Budget Committee Chairman. Mitch Daniels, who's former governor of Indiana and also headed up O&B at the federal level. Tim Penny was an independent from Congress, and kind of a who's who board of directors of former economic, fiscal, budget policy experts. And we have a staff of about 30, where we issue analyses and reports, work behind the scenes with members of Congress and their staff, engage the media heavily, and try to build coalitions outside DC that want to raise attention and awareness on these issues, because we think it's critically important. I'm sure we'll talk a little bit more about that, but our country is on a fiscally unsustainable course, and absent changing that path, going to have drastic negative consequences for our well-being and our national security and the health of future generations.
Now, before I get into the meat of the matter, Patrick is dying to ask a question about what's going on in the news right now. Patrick?
Yeah, Mike, and it is a pleasure to meet you. I'm not terribly bright, so I'm not going to get in the middle of you and Clay having a discussion about all the important details that you need to talk about. But from sort of the average schmo's position as an American, it seems like for my entire lifetime, and that goes back to the 1800s, about twice a year, we have this thing where there's a budget problem and they can't, the budget, the government's going to shut down. And as I understand it, tomorrow night, if they don't do something, it's going to shut down. And we go through this over and over and over. And it seems to me, sitting here in my perch in middle America, that it's just a case of kicking the can down the road and refusing to deal with the main issue, which is there is huge budget problem in this country. And I guess I don't get it. Isn't that, Mike, and I don't want to get into politics, but isn't that what the November election was all about?
Well, let me say this, Patrick. This is a hell of a way to govern the country. I think that's basically kind of the crux of what you're getting at, right? And I think people sense that, right? They sense that we're in Washington, right? So we are in the bubble, okay? But even outside the bubble, I think that's what people sense. It's like we're supposed to be the greatest country in the free world, right? Greatest country in the history of the world, right? And yet, what we're doing in governing ourselves is we literally govern by crisis, right? We kind of lurch from deadline to deadline. Only these forcing deadlines seem to get action to happen on anything, And even when the action is happening, which I think is the point you're getting at, Patrick, even when the action is happening, the reality is they're not really talking about the core big problem here with the federal budget, right? When they lurch to these budget deadlines and what gets in the news about threats of shutdown every so often, certainly over the last decade or so, they seem to be pretty consistent, right? You're certainly right about that. What those are is they're talking about a tiny portion of the budget, relatively speaking. I mean, the budget is huge, right? We got well over $6 trillion federal budget, right? It's a huge budget and hard for people to wrap their heads around. But within that budget, they're only talking about a small slice of it, maybe a quarter to 30% is what they call the discretionary portion of the budget. I won't get too technical, but the discretionary portion of the budget, that's the part of the budget that kind of funds many of the different agencies and things people think make up of government, right? Across, defense is about half of that, 25-30%, but also the Department of Transportation, Department of Education, National Institutes of Health and Research. It's where all these FDA, it's where all that money is. But the big slice of the budget, right? Over 2/3 of it is in mandatory spending programs, big automatic entitlement programs that grow in perpetuity, right? Just automatically without having to decide anything every year. These are mainly Medicare, Medicaid, Social Security, and also a big slice is interest on the debt, because our debt is huge and interest is the fastest growing portion of the budget. So when we lurch to these crises, we're only dealing with that smaller portion, right? And not the bigger piece. And yes, we push up against the deadline. And then, look, I think there's warranted frustration going on the Hill right now. I mean, there's warranted frustration about that these big, massive bills are just kind of dropped on at the last minute, like right before the holidays. Everyone's trying to get out of town, and it's either vote on it or not. And I mean, it's really frustrating, okay, for members. And some of them really want to do the right thing and try to have these bigger conversations. But yeah, we're in a tough place about it, Patrick. I think you're you're honing in on the core issue. We're lurching from crisis to crisis. We're avoiding the big issues, right? And we continue to punt those down the line to the detriment of other people. And I think people sense that, and they're frustrated about it.
And Clay,
Just
I just want to make one more point before I let you guys
Sure.
get at it. Mike,
Sure.
you talked about it dealing from crisis. In the 1990s, during the Clinton administration, they had a gentleman in that administration named Rahm Emanuel. And he went on to become mayor of Chicago and do other things. But he was the first one I ever heard utter the phrase, from a strategic standpoint, never let a crisis go to waste, okay? And in a political sense, that's fine. You see something, you exaggerate it, you try to exploit it for your own political purposes. However, I think never let a crisis go to waste has morphed from a little small strategy to the MO of politics in this country. That is a surefire way to fail. And quite frankly, those that do it, and those that do it with the deliberation, the deliberate intent, are despicable. We've got to start stopping dealing from.
Patrick, I've got to respond to that. What you're holding in on here is a distinction in the following sense. Like, we're not naive, right? There's always, from a political standpoint, politics is a rough business. In a political standpoint, you're always going to use leverage that you have. And a lot of these times, these deadlines, these crises, right, whatever, it's like these action forcing things are real key moments to try to use leverage and try to get things done. But the key is to get some things done, right? Right? And so what's going on is that actually what often happens is it's like, how do we use... Forgive me, something just dropped from my ceiling. But okay, how do we use these moments to actually get some things done? Because what's happening now is it's all about winning. It's all about winning. It's winning over governing, right? On both sides.
Yeah, exactly.
How do you position yourselves for how this is going to work to my benefit as a party broadly, for the next election, as opposed to looking out for the long-term benefit and health of the country, right? Again, politics has always been part of it. Looking out for the next election has always been part of it, but it's become too far where that is now the core and primary, in some cases, sole driver of decision-making at these crises, deadline moments. And that's what the real problem is at the crux.
Yeah, no, I hear you. Just by the way, FEMA is on the way to solve that calamity that's about to happen with your ceiling caving in. So don't worry about it. They'll be there. They'll be there in about 3 months. So hang tight.
We got a new Congress coming in. Republicans control the Senate, the House narrowly. The White House. What's the group? What are the few things, if you could sum up, that you are going to try and educate congressional staffs about? And you mentioned that the discretionary budget's 25%, 30% of the budget that everybody talks about. Talk about the elephant in the room. What can we do with this entitlements that really is just a transfer of money from one group of people to another and mandatorily grows and expands every year? If you could talk about those just to get us started here.
Sure. So in terms of what we're going to be educating people about, first is we get in there. There's a lot of turnover, right? There's a lot of turnover when you have a new Congress, got lots of new staff, lots of new members, and we've already been briefing some of the new members even before they get into office. And we're briefing them first and foremost, just kind of get them the big picture of the fiscal situation, right? Just like try to wrestle with this. These are huge numbers, right? So it's some of what we've already been doing in this discussion, right? Just kind of paint the picture. This is our budget. Here's where the makeup of the budget is across these different categories. And here's what our debt picture is. And our debt is right now, we evaluate our debt measured not at the gross debt level of 36 trillion everybody talks about. We look at our debt outstanding at the public markets as a percentage of our economy, because we think that's a more accurate way of kind of measuring your sustainability, your ability to borrow. You're going to measure it in some ways against the resources, right? So as a measure of your economy, and also can compare over time metrics on that. And right now, as a percentage of our economy, our debt is near 100% of our economy. It's almost at the highest level historically that we've ever had in the country. That's right after World War II, and set to surpass that. So Clay, those are the types of things. We'll just be educating staff. We'll be briefing staff on the top line of the numbers. That's first and foremost. The second thing we'll be briefing them on is the key moments and things that are coming up next year and how this is all going to play out. One of the favorite words, and maybe we can get into this a little bit more in the discussion, we have time, is favorite words people are throwing around is something called reconciliation. Okay, now I tell people that don't know what that is at all outside of Washington. It has nothing to do with like a nice reconciling of people coming together, or if you're a Catholic and a Christian, it has nothing to do with the sacrament or anything. But it's basically a whole budget process that they're going to use to try to jam through in a partisan sense, right, their priorities, because you can get around the filibuster. You can do this reconciliation process with less than 60 votes. And they're going to the Republicans are going to try and get through a lot of their priorities, from immigration to taxes, et cetera. Big budget implications. So obviously, we'll be educating people on that. But to your point on the big ticket items, right? So I was saying this earlier, but to put it in context in a different way. When you look at the budget and you look at projected spending growth over the next 10 years, it is three things that make up 87% of the projected spending growth in the budget based on how the baseline is developed, right? Three things make up 87%. Healthcare spending, Social Security, and interest on our national debt. It makes up 87% of projected spending growth. Because that's where the money is, right? That's where the money is if you're going to try and bend the trajectory. And the other big factor here to be thinking about when you're talking about these big programs, Medicare, Social Security, several things. Number one is they are some of the most popular programs for good reason, right? They provide a very important benefit for people. People think they are inherently fair because there's a sense as a social insurance program that they pay into them. They have some buy-in into them. They are very popular programs for good reason, right? So you have to take that into account from a political standpoint, obviously, but also they provide vital benefits, and they are in and of themselves on paths to insolvency, right? So aside from being big spending items in the budget and just driving a budget challenge, they are in themselves going to run out of money to service their benefits, right? But within 10 years, Social Security is going to be unable to pay scheduled benefits due to a mismatch in revenue and spending. That'll necessitate an across-the-board cut by law of 21% on everyone that's on the program at that time, right? That equates to about a $16,500 cut for the average two-income couple, right, at that
Right.
time, right? So they're insolvent of themselves. You make those programs solvent, you go a long way to solving the budget problems. Now, to your question too, and just like what we do about them, okay? I'll take them in turn, right? So in Social Security, there's been proposals and things out there for years on what
Right.
to do with Social Security, and the eventual day will come where they're going to have to come together. Patrick, maybe it's another crisis, right? But it's going to be another moment where they come together, and I can pretty much guarantee some of the policy options are going to be on the table when they eventually do that, and they're going to be things like, okay, on the revenue side, let's look at the cap by which we stop taking in Social Security payroll taxes. Right now, it's set at a certain level. It's about $170,000 or more than that. All right. You stop paying payroll taxes after that. Now you stop getting requisite benefits too, right? But you can play around with that cap. We haven't adjusted that cap in decades.
Years. Right.
Decades, right? So you can adjust that cap, right? You can also index it in different ways going forward, right? But you can play around with that to get more revenue. And by the way, there's polling on that. There's different things that has bipartisan support, believe it or not. I know there's like this view on the Republican side they never raise taxes. You poll on some of that, and people get that kind of idea. Well, okay, we could probably get some more revenue on that side. Then you also do other things. You play around with cost of living adjustments, meaning like how we measure inflation as it pertains to Social Security. Right now, we measure inflation based on the cost of living or CPI index. But a lot of economists, people look at this and they actually believe that the way that the government measured that overstates inflation as its adjustments, right? And there's this thing called chain CPI that is an alternative. And what that means is you take account for the fact that when something goes up on the price of something, people make substitutes, right? So
Right.
Price of chicken goes up, I'm going to go and buy turkey or whatever, okay?
Right.
And
right.
like the current CPI index does not adjust for that at all. And chain CPI attempts to do so, right? And make it a more accurate measure of inflation. You apply that to programs like Social Security, that can help. People might see that as a cut, but other people would see it as a more accurate measure of inflation, right? And then there's other ways to adjust benefits to progressively change them, where you can adjust benefits to slow the growth, not cut, slow the growth of benefits for people at the wealthier end of the spectrum that get Social Security and accommodate people better at the lower end. You do several of those things, you can make Social Security solvent for a very long time. You don't do it. Why? Because it's really, really politically hard, right? And no one wants to talk about Social Security without getting killed. On the healthcare stuff too, Clay, plenty there to talk about, but maybe I'll stop and see if you want to dig in on it.
Yeah, sure. Because I always thought the cap on income, what is it, like you said, 170,000. Well, after that, even though you don't get the commensurate amount of benefits in the end, instead of taxing it, there's the employer side and the employee side. Put a 3%, say, or 4% on anything above that, and help to make it solvent. And even though that's detrimental to a lot of our own personal interests, looking at the country in the long term, and I think people do want to see the country survive and prosper. It's the cost of freedom. It's the cost of what we do. Obviously, these programs are there because we chose to have them there and support having them there. Healthcare, the same thing. The cost of healthcare is out of control, and I know you all have some plans on how to make that more solvent going into the future. The the other thing, Mike, that is important to everyone here in Maryland, our economy and the federal largesse that comes to the state government will be affected by Doge and what the Trump administration wants to do to get things under control. And I wouldn't say there's panic, but there's real concern in the halls of Annapolis about what the feds will do to help control spending. If you could speak on that as to how it may affect Maryland and what Maryland should do on that to uh, speak as to what your group's plans are and concerns are with that.
So I think that potentially, to state the obvious for anyone following the news, particularly in the last day or two, the things associated with DOGE, the so-called Department of Government Efficiency effort that's going to be headed up by Elon Musk and Vivek Ramaswamy, is bringing attention to budgetary kind of fiscal issues in the last several weeks in ways that groups like us and folks on fiscal issues haven't seen in a really, really, really long time. Okay, so that's first and foremost, right? Like we issued a statement very shortly after that was announced where we welcome this attention, right? We welcome this. We also think they're both very accomplished people, right? So anyone wants to take an outside look at this, like, again, we welcome it. Now, that being said, like, we obviously, a lot of details still are not clear, okay, on what this effort is, what it's really going to look like, how it's going to be structured, what authority it has, because right now it doesn't seem to have any authority, right? Nor can it seem to get any based on it being sort of an outside advisory board, right? So we're obviously keeping an eye out with that. We're trying to work with them. We're going to be very supportive, and then watch what they do and comment on it and try to help, right? Mm-hmm. So that's just big picture. Now, when it comes to Maryland, yeah, obviously, the state of Maryland has many parts of its economy are very interconnected, obviously, with the federal government. And so anytime someone's kind of looking at sort of getting under the hood here, it's very unclear what that would mean. And I can sure understand it would cause some anxiety. I think that, a few things I would say is, one is that there's, it's always good to look for, right, waste and inefficiencies, et cetera, right, as broadly termed. And certainly there's areas to find that. And I think hopefully they will find some. That's all one person's inefficiency or waste is another person's really maybe pet program or, or different thing, right? So I think we'll see how that plays out. But it certainly should always be a focus to do that. But I guess I'd bring it back a little bit, Clay, to what we've already been talking about. If you're really talking about something that's going to achieve savings, especially the government, you got to go to where the money is, right? You got to go where the money is, right? Like, you can root out waste and inefficiencies in other parts of the government. And I'm actually very intrigued. This isn't my area of expertise, but I'm very intrigued by what, getting under the hood of the technological systems that the federal government's using. I'm sure there's all hosts of inefficiencies. You hear all sorts of reports and stories about the different agencies using different platforms, or even within the same agency, that are incredibly outdated and things. Like, I think there's ways that outside expertise could probably help drive some efficiencies, but you got to go to where the money is, right? And so I'll give you some examples of what I'm not sure if people would consider these efficiencies, right? But this is where some money is, right? So in healthcare, for example, in healthcare spending, there's some folks that are putting forward policy proposals that get at the idea of what they refer to as site-neutral payments. Now, what that means is it's trying to address a problem where, as you all may know, there's been a big movement in many recent years here to have hospitals, right, that are buying up many of the doctors' offices and outpatient facilities, right? Consolidating, right? Now, one of the reasons that is important in this context is it is the case that Medicare, okay, actually pays, right, a different amount for the same exact procedure in many cases if they're provided at an outpatient clinic versus inpatient. Right. Same exact amount, very different amount, same procedure, right? Now, hospitals kind of buying up outpatients, to try and get around that, right, and to try to make more money. So there's a movement to try to equalize payments in that regard, right? That's kind of common sense. Now, there's special interests involved in that, obviously, that will push back against that. But is that an efficiency? I would argue it is in one sense, and it's certainly in savings. You can talk about hundreds of billions of dollars by trying to equalize payments in that way.
Right.
Again, very ingrained special interests within communities that are associated with hospitals that will push back against that, right? Another example would be in Medicaid, right? Medicaid, huge portion of state budgets, right? But it's a partly federal. It's a federally funded and state funded program, Medicaid, right? Unlike
Right.
Medicare, which is fully federal. So Medicaid, the federal government partly matches what Medicaid pays out in the states. But what states do is they use provider taxes, creative provider taxes to tax providers, and then as a result of it, inflate and be able to get more, matching from the feds than they otherwise would get just by putting a tax and then kind of recouping some of the benefit from those that are taxing, and actually the provider gets a little bit more too. So it's kind of like a little financing scheme, right?
Right.
Where the state and the providers maybe work out better, but the federal government doesn't. So you can reform that tax, right? That's going to save the federal government a lot of money. Okay.
Right.
And efficiency, I would argue, it kind of is, right, in one context. But again, that's a tough fight, right? So it's where the money is, Clay. And my last thing I'll say on this is, because folks in Maryland primarily are working for a lot of these agencies. I go back to what I said before about the discretionary versus mandatory portion of the budget. So much of the agencies, what they're talking about, are coming out of that discretionary portion of the budget. That discretionary portion of the budget is going to continue to get targeted, continue to get squeezed, continue to get a focus, unless we turn the attention to the bigger ticket items that are squeezing the budget, which is the drivers, mandatory spending, healthcare, Social Security, retirement programs, and also having an honest conversation about how much revenue we need in the country.
Well, Mike, I'd like to have you on after January the 20th, as these plans start to be proposed and debated, and get your view on what's going on with that and what your organization is doing uh, as the new Congress comes into play and as the new administration gets ingrained into these issues. But by the little clock on the wall, Mike, I can see that our time to wind down is here. So we invite you back to be on soon, but it's time to say goodbye, Patrick.
Goodbye, Patrick.
Goodbye, Patrick.
Goodbye, Patrick. And Mike, it was a pleasure having you on. Good to meet you. And we'll have you on after the new president is inaugurated. How about that?
Great to meet you, Mike.
Look forward to it.
Thank you so much.